Hello, I'm Dr. Guy Yatros for Dental Sleep Medicine Insider Magazine. Today we're going to talk about what you do when you deliver the device to a patient and maybe they're not responding. Maybe even the AHI is worse in a follow-up test than it was when you began. And what causes this? And this is one of the things that kind of frustrates new dentists to dental sleep, and we'll talk about what you can do about this today. What are the reasons for this? Well, first of all, probably the most common reason I find that a patient will be tested and their AHI maybe is 18 on the baseline, and then we test them and their symptoms are doing better, their snoring's better, and then we go back and we do a follow-up test and maybe their AHI is the same or maybe even 20, it's even worse. The most common reason is we're not comparing apples to apples. Sometimes the baseline test may have been from many years before and the apnea's gotten worse. Sometimes the baseline test is a PSG and we're comparing this to a HST, a home sleep test, with a follow-up. And we can have big differences between the types of tests and basically how old they are. So, and even the equipment itself. So we may not be comparing apples to apples. The other is weight gain. Patients who gain weight, obviously their airways become narrower, more collapsible. Typically, patients, most people do gain weight. And again, if it's been a year or so and the patient's gained even as much as 5 or 10 pounds can make a difference. So this is one of the reasons we weigh all of our patients at the beginning of treatment and each year for annual recall, because we want to monitor that because it can certainly have an effect on the airway. The other is really just per night variances. I mean, each night we sleep a little differently. If we sleep more on our back on the follow-up test than maybe we did on the first night, that can make a difference. The position is huge. How sleepy someone is, the more sleepy you are, the more deeply you'll sleep, the more prone we are to having a collapsing airway. As a patient maybe did the PSG the first time and did a home sleep test the next, as we mentioned, in addition to being different types of tests, you can even have a difference in what you do that night, what you eat, and alcohol that you may drink. The patients may have had something to drink of a home sleep test. How well they're breathing through their noses is very important for our sleep apneic patients, and maybe their allergies are acting up. Maybe they have a cold. Maybe they have a pet in the bed as a cat or something with dander as well. And the sleeping conditions overall, is the room the same and so forth. So there's a lot that goes into the per night variances of these tests. And you know, when all else fails, we may think about this, the apnea may be worse. As much as around 9 out of 10 times, these devices work well and we have great response. But as much as maybe 10%, we have what we call non-responders, that the apnea just doesn't improve, the airway doesn't improve as much as we want. So we always have to consider that maybe this is the best we can do. And also remember, this is not an exact science. You can do tests on people multiple nights without devices in place, and you're going to get different results. So as dentists, this is one of the things that we struggle with because dentistry is very exacting for the most part. So if we keep the goals in mind of treatment, this will make this process easier when you have patients who you feel aren't responding appropriately, or maybe that their apnea or the AHI at least is getting worse, which it may or may not mean that their apnea is. The goals of treatment, I like to break down into 3 steps. The first one is they need to wear the device. Okay, the other 2 main goals of treatment don't matter if they're not wearing the device. After they wear the device, we want to address their symptoms. So oftentimes the symptoms may be better, but the AHI isn't where we want it. Well, at least we're halfway there. If the patient is complaining of sleepiness or complaining of snoring, and that's what brought them through your door, and you've achieved that, well, then let's pat ourselves a little bit on the back at this point as we try to improve the overall objective success, was what we've been talking about. So when we go through these steps, I think the best way of a dental device is that we start with the subjective symptoms. We work with those, and hopefully we tweak the devices until the patients are happy with the subjective improvements that we have. If we get to the point where they're happy, then we do a sleep test. If at the first check that we see the patient after delivering the device, typically about 3 weeks after we deliver the device, at least in my office is how we do it. If symptoms aren't as good as we'd like, we tweak the device more forward. Eventually, like I said, we do a follow-up sleep test, and if that's acceptable, we're finished with treatment, in which we go into a 6-month and then an annual recall. If the objective or the sleep testing isn't where we want, we may do follow-up testing, but if you'll follow our protocols, we can really minimize the test. So again, if we look at this particular patient, we can see what DS3, the software that we develop and use, helps a great deal here, is how we can look at the patients at a glance and we can see all their symptoms, from Epworth to Thornton to snoring levels, energy levels, how much they're snoring, how many times they're waking up at night. And we look at the baseline, which I have on the screen now, And then as we come in for the 3-week or the follow-up checks, we ask the patients the same questions, and now we can see at a glance this particular patient is doing quite well. Their Epworth is down from a 19 down to an 8. Their snoring is decreased on the Thornton level from a 12 to a 4, or the 0 to 10 level from a 9 to a 3. And we can see at a glance if the patient was concerned about sleepiness and snoring, maybe we've already achieved the second goal, which is subjective success. After we achieve the subjective success, we're going to do the follow-up sleep testing as you've probably been doing. But for years, I did a test. If it wasn't where we wanted, the HI wasn't improved to the extent that we wanted, we did a follow-up test after moving the device more forward over a few weeks period of time. And sometimes we do 2 or 3 or 4 tests. Once the patient's happy, wearing the device through the night, the protocol I like the best is a multi-night home sleep test. The goals of the home sleep test are to hopefully see an improvement in AHI. Ideally, we'd like to get the AHI below 10 and cut in half. That's what the AADSM says is a successful treatment. We also would like to see the SpO2 levels, or the pulse oximetry levels, dropping to where it's not much below 90% of the night, that we don't we don't get less than 90 for any period of time, ideally less than 1% of the night. We don't always achieve this, and we got to make sure that we give ourselves a little bit of a break here. If someone's AHI is 70 and we get them down to 15, maybe that's the best we can do at times. The way I prefer to do this, again, is a multi-night test. We can do 1 night test, but then we have to repeat it. So we can do a 2-night test. We have more data. Ideally, we can do a 3-night test like we show here on the screen. If we have the baseline is on the right side, and each night the patient moved a little bit more forward. You can see on the screen here how the AHI went from 29 to 19 to 8, and then down to 6. So obviously that last night when they were a little bit more forward, as you can see, we went from 1 millimeter on the George gauge to a 5, it says here, so 4 more millimeters forward. We've made a big improvement. You can see how the SpO2 readings follow along with that. If you only have a 2-night test, then we just move a little bit more forward on the second night and see how we do with that. At this point, we've got most of the information we need to make a decision. The other way you can do the testing is you can send the patient to the sleep lab. We can titrate the device during the sleep lab. We can turn the device every 45 minutes or so and move the device more forward until we achieve the maximum AHI that way. Oftentimes the technologists are hesitant to do this, so we may have our patients actually advance the device at the sleep lab. And that's a way we can do it as well. But again, if it was all up to me, a home sleep test done 2 or 3 nights where we have 2 or 3 different positions is the way that we can rapidly get through these stages of treatment. I know I went through that pretty quick, but we want to try to make these videos quick so you can just get some good information and understand that treating dental sleep is just steps. And that's what we do well here at DS3, is we help our team members and our staff and our patients go through these steps very rapidly. And if you do this efficiently, we can do this in about 45 minutes or less of doctor time and really help treat our patients if you have a system for each of these steps. So thank you very much for tuning in to Dental Sleep Medicine Insider Magazine, and I hope this has helped you improve your dental sleep practice.